Hello, my name is Adam Riedel, and this is my BSN225 oral administration video, oral medication administration video. For this, I need a couple things: a stethoscope, a blood pressure cuff, some sanitizer, some gloves, my medications, my MAR, and a patient. In this scenario, I'm going to use MAR number 2, which was given, so I'm going to verify my provider's orders. Tylenol 500 milligrams in a 15 milliliter route. Diazide 37.5 milligrams in a 25 milligram capsule, Plavix 75 milligrams, Dilantin 100 milligrams, and erythromycin 250 milligram capsule. So when I'm taking this out of the Pyxis or the med cart, I want to make sure that I'm verifying my 6 rights of medication administration. So I want the right patient, the right time, the right drug, the right dose, the right route, and the right documentation. The documentation for this will happen after I give the medication, but I know that I have my right patient, which is going to be Amy Riedel, my right dosing, so I'm going to kind of gather those at the same time. So with the Tylenol, I'm going to dispense this in front of the patient, but that's going to be 500 milligrams, so we'll want 15 mils in the cup. And then I have my erythromycin, 250 milligrams. I have my Dilantin, 100 milligrams. I have my Plavix of 75 milligrams, as well as my Diazide, 37.5 mils in 25 milligram capsule. So I have all my medications. I have everything I need. I'm going to go to my patient's room. Knock, knock. Hi, Amy. It's time for your medications. I'm going to close the door for her privacy. I'm going to do some hand sanitizing as well. Can you verify your full name and your date of birth for me?
Amy Riedel, 21093.
So for one of your medications, I do want to make sure I have an assessment of your blood pressure, so I'm just going to get that really fast here. And that's the arm that you wanted to go with? Mm-hmm. All right. Coolio. So just finding that brachial artery real fast before I put this on all the way. Tight, but not too tight. All right. So, got that, and it is a little bit high, which is going to be kind of concurrent with the blood pressure medication that we are going to give you. So, on that note, Amy, one of your medications is a blood pressure medication, and I'm also going to put some gloves on here before I start administering these medications as I'm talking to you about what they are and their side effects. So, the first one, Amy, is going to be called Diazide. 37.5 milligrams in a 25 ml capsule. That's kind of a 2-for-1. It's a water pill as well as a blood pressure pill, so it's going to help decrease your blood pressure and help you with urination. So you're going to be expecting a lot of urination with this. You might encounter some rashes, so let us know if you find any of that kind of stuff, and that's going to be your Diazide. So we'll go ahead and administer that. Another pill is going to be erythromycin, 250 milligrams. This is an antibiotic. This is to treat your infection. That can give you nausea or diarrhea. Just let us know if you have any of those. It's important, too, that we make sure that you take the entire dose to make sure we have any risks of getting antibiotic-required infections if you don't take your whole dose. So we got to make sure we give you the whole thing all the time until it's finished. Your Plavix, 75 milligrams. This is an anticoagulant. This is to help with thinning your blood, and it's going to give you bruising and increase your bleeding. So just make sure that if you are bumping into things, to be well aware that you might bleed a little bit more. If you have a nosebleed, you're going to bleed a lot more because of that. And then Dilantin. This is an anti-seizure medication to help with your seizures. And one of the side effects with that is slurred speech, as well as some dizziness and dry mouth. So just make sure you let us know if you do start feeling slurred speech, things like that. As well as this last medication here. And when I open this is Tylenol 500 milligrams. It's going to be 15 milliliters, a little bit there. open this up, make sure I put this such so, and I have a little paper towel for cleaning up afterwards, and I want to make sure that I'm at eye level with this at 15 milliliters. Okay, and I'll just give that a little wiperoo. Do that, and then we'll just go ahead and don't actually take those, but we're pretending. Glug glug, glug glug. Beautiful. Any problems with swallowing any of those?
No.
Okay. And then just the Tylenol there. Yummy, yummy. All right. And you have your call light within reach. Are you comfortable right now, Amy?
Yep.
Do you have any questions for me about any of those medications?
No.
And I'm going to take my gloves off. I'm going to throw them away. I'm going to look around the room, make sure everything's safe. Her call light's within reach. And I'm going to perform some hand hygiene as I exit the patient's room. And as soon as I get back to the EHR and the MAR, I'm going to make sure I document the drugs I gave and the time that I gave them at. Thank you very much.